Thank you to all of our panelists. Great presentations. Now's the opportunity for you to engage in a conversation. So please use the microphone if you've got some questions. And maybe I can start the conversation. Again, I'm struck by, the strong articulation of the case for business engagement. And Nico, you ended with that. I think, Kathy, that was throughout your presentation. And yet, if you look at the HERO environmental scan, Nico and Kathy, there's actually very little going on. And again, we're talking about business engagement at a community health prevention level. So that disconnect for me suggests, what are the barriers? Why isn't business engagement more widespread? And most importantly, what could potentially be the catalyst to make more engagement happen? And maybe, Kathy, you have some insights in terms of getting your Dow Chemical leadership engaged at a community level that would be helpful to shining some light on these issues.
Is this working? Just to that point, first of all, I agree that we're in an early stage of evolution. I think what we see is early adopters who have put this story together. But it's really that it needs to be put together for people, and there needs to be consciousness raising and education and helping people to see that. And it won't happen, and we've discussed this several times in this roundtable. It doesn't happen by going to other sectors and asking them to get focused on health as the pinnacle of all of their activity, because it's by saying, what are your priorities? Let me help you understand how health is important to them. So we have to construct the argument about the success of that organization and about the success of the business community so that the employers and the businesses can clearly see how this kind of effort is critical to the achievement of their priorities they've already established. And so there has to be connect the dots very clearly and credibly, and doing that to understand the priorities of the organization and connect health. And so that has not been done broadly. And the connectivity to the other priorities that they have, like education, or that business has already identified as a critical education, how do they see that those are not separate issues? Those are connected issues. And so I think we've got a big education to do. But even the barriers that you shared, Nico, from the work that was done is three things. That there's just a lack of understanding, pure and simple, which pleads for education. And then the playbook, really creating a playbook. So what would I do? Because this is not the core of expertise. And so it's easy to become overwhelmed and just say, I just can't deal with this. Somebody else will have to take care of it. So it has to be simple and constructed in a framework. And I think all of that is imminently doable, but it's real work that has to be done.
Nico?
I would completely agree with Kathy's comments. I think in the cases where we see employers really figure out for themselves inside their own walls that creating this notion of a culture of health is working for them is a completely different conversation, if you will, than actually stepping outside of their company and going into the community. And so this notion of an intentional investment into population health improvement in their local communities is a whole different story. And that's where I think the understanding piece starts to become difficult. But it almost jumps from an understanding of the why, the business case, to even if I understand why, how can I do this? And what do I need to do? What is my role in it? And this is where I think the biggest, perhaps it's the biggest barrier, but it certainly would be a huge leverage point to accelerate movement forward in this area, would be to figure out what is the role of that convening organization or the convener in the community that can bring stakeholders together, is in a place of respect and trust, so that that convener role is in fact represented by an organization that can play that role. It's a trusted convener, and the convener then can build bridges, if you will, to bring these stakeholders together and work together in the local community, so that roles can be identified, responsibilities can be identified, measurement can be put into place, all of those issues.
That's a great comment.
Andy,
And, yeah,
I had
sure.
a quick follow-up. My initial comment was about helping to connect the dots between the existing priorities of the organization and the population health of the community, and keeping it simple. But I think another critical piece is if you go to a business and they're struggling to just sort of meet their own objectives and be successful and survive in a difficult economic environment, if they think that what's layered on top of them and now is they have to solve this most unsolvable of all problems as sort of like it's on their shoulders, like, okay, so now what am I supposed to do? To think of it in terms of making it doable. And that's why, as I was coming to my last slide about what we did at Dow, is to say you can do this by asking the business to do things they're already doing, but to do them smarter. They're already doing philanthropy, but maybe it's not being spent wisely on those things that are evidence-based that make a difference. They're already filling roles on the United Way and board in the local community organizations. Just ask them to do that with greater insight. They're already
Strategic focus,
taking
yep.
all of that litany of actions. They're already involved in policy and advocacy work, but if they could do it by being informed, and that's why I think this playbook concept, by helping them do the things they're already doing and not feeling like this is now the weight of the entire world added on to their already challenging set of activities, is helpful.
Right. And it links very much to Nico's comment about the trusted convener and the coalition within the organization. So I, as a leader in the community, don't have to take this all on. There might be an entity, an organization where my voice can contribute to that overall community effort. And I think we'll hear more about community coalition engagement further in the discussion today. With that, great comments. And Jim,
Sure.
You're up.
I'm Jim Nickman, president of New York State Health Foundation. Welcome to New York. I just wanted to pick up Michael's question, is this possible? And sort of build on that. And I think there's great synergy between the first presentation and this panel, and let's hope. It's interesting, I've made up the numbers like you've made up. Actually, I came to $200 too in some ways. But I've thought about in terms of trying to convince health providers to put up the money for some of these things like health trusts and health enterprise zones and things, because in the long run, if they are capitated or they start owning insurance companies, it's to their advantage to create community health also. But adding the business dollars is intriguing if you can think about the case for health and health investments, healthcare corporation investments and employer investments, then you start getting some real money. And your numbers, I think, are just right. It doesn't take a lot to get to a number. So I think a couple of things to try and stimulate that. One is a lot of us are trying to support leading communities, as was suggested at the first presentation, to really show that this works. And I think we need to get that knowledge, as Kathy has just said and Nico has just said. But secondly, I think we have to look for our opportunities, and sort of places where there's something special going on in one way or the other. And ironically, like in New York, I think Brooklyn is a special opportunity because we need to rebuild that medical care system almost from scratch. It's just a mess if you've been reading about it. But and when you think about rebuilding it, it makes sense to say, let's take 2 or 3% of what we'd expect to spend on medical care and spend it on population health instead. And so I think we might be looking around the country looking for these opportunities where major investments are needed in the medical care infrastructure. So it's a moment to sort of rethink how you want to balance those dollars, and then bringing in employers to add to that. I guess the question I have is, for you especially, is does this have to be mandatory, or could you imagine sort of health trusts and funding for these things happening through voluntary contributions of employers?
I don't think it should be mandatory. I don't know how you'd make it mandatory. Well, I think that the businesses need to see, number one, it's not a lot of money, and of course, the money's in the bank for the companies that have the money. The companies that don't have the money. By the way, part of my model, the small employers with not as much money, part of their cost is covered by the federal government, but all the federal government's funding for this comes from the increased taxes from the growth of jobs. But number one, show employers it doesn't cost much money. Two, show them it has a direct, measurable financial benefit to them. Three, show them how to do it, and I think it'll happen. But also to build on Dan's earlier point, it's probably not a national solution. It's probably finding the communities and the businesses that are ready to do it now and building on those successes. Within Medicare and Medicaid, within Medicare, there's already authority to support the clinical wellness exam and smoking cessation programs, weight loss programs. So Medicare already has the authority to do this. With Medicaid, I know that it's being studied. I don't know what actually has resulted from the experiment that Medicaid has been conducting. But I think I think the more that we just appeal to the selfish interests of business, the more this will get done faster.
Lila, hard stop at 10:45. Okay. Next question.
Thank you. Just short question. Maybe it's been addressed in the past. My name's Charles Yalbar. I'm a physician with Lockheed Martin, and on the panel number 3. The question, though, is sometimes someone said that we were kind of plagued to repeat the mistakes of the future if we don't look at the past. And I'm just wondering, and years ago, 100 years ago and less, even when I was at Humble Oil Company, for instance, many years ago, and I've seen it in train stations and train companies and others, employers were involved with the community very tightly. And what happened? And maybe it's a historical look at that relationship in the United States, say, not even internationally, but United States for sure, to say what has transpired, what happened, and how did industries, so to speak, kind of back away from what they were very much involved with.
Yep.
Well, the economy was bad in the past. Think of the Depression. And in fact, I think it went the other way. The Depression kind of engendered a lot of more philanthropy locally with communities and also in the healthcare arena. So I don't know if anybody's looked at that. Maybe that's something of a research project.
It's a very interesting question, and for the last 10 years, I've been involved in business and health coalitions around the country. And we've often heard from business and health coalitions is that it's the sort of medium-sized companies that have a real presence in that community that's much easier to engage in community-wide endeavors than the very large jumbo multinational corporation that even might be headquartered in that community but has plants all over the place, is international. So anyway, it's a very interesting question, and others have comments?
Yeah, in fact, I was going to make the point that in the work that we do through the health system, as we talk to larger employers versus small, medium-sized businesses, oftentimes what we end up with is that the conversation you have with the CEO of a small business is, it makes complete sense why you would connect to the community. Those CEOs are already there and are typically already doing something with their organization that ties into their communities. But then when you sort of try to beef it up, so make it a larger effort, that's when these questions start coming up, like, well, what's really my role in that, and how deep should I go? Those kinds of things. Whereas with the larger organizations, it tends to be an approach that an organization really needs to adopt in order to make it work. There's a lot more flexibility in these smaller organizations. And when I talk small, it's like less than 100, 200 people.
Next question. I think this will be the last question before we break.
Ray Baxter from Kaiser Permanente. I want to ask a bit of a different question. So far in this morning's discussion, we've talked mostly about physical health and about a particular set of risk factors we commonly associate with non-communicable disease. But aside from a bit of conversation about social connectedness and purpose, we haven't talked very much about the mind and the spirit. We've mostly the implications have been about the body. What I'd like to ask the panel is how you see the role of behavioral health issues in building this connection between business and community. It's something that everyone is touched by, experiences the stigma, and we are still in many ways in the dark ages about addressing it openly. But it also seems to me that it conceivably could be a very big opportunity for us both to reach businesses and for businesses to show up in a different way around not only their workforce but needs in the community. So could you comment on that?
So I did not take that same message from this morning that it was limited to physical health. I really look at it as a well-being context, multiple dimensions: emotional, mental, social, career, physical health, of course, but also things like meaning and purpose. And actually, when I sort of think about how the opportunity that an employer has to connect to their community can address some of the underlying real risk factors, if you will, for their population, for their employee population, we see things show up, prevalence of employees even filling out health risk appraisals that indicate mental or emotional abuse at prevalence rates of 20%. You know, are you going to take care of diabetes at 5%, 3%? Or are you going to take care of mental or emotional abuse, which not necessarily happens at the workplace. It's somewhere in their life. And so connecting those things to community has a huge opportunity for the employer, you know, on that side. So I think this idea that you don't artificially separate the workplace from the community is a huge, you know, recognition of the potential impact. So I would not limit it to physical health whatsoever. Definitely make sure that it's well-being organized.
Ray, appreciate your question. And I guess I hadn't thought of them as separate either, in that in my own experience, the way we approach it is a very comprehensive view of health, and the inclusion of behavioral health is part of that, both inside the company and as well as outside in our community work. So the link, you know, looking at how it's being used in even the patient-centered medical home movement and the building the bridges there, but also to the social services and the organizations like 211, and how do you bring in the whole context of system into that community work? So appreciate your question, and we might not have surfaced that as a priority, but that's the way I've been approaching it.
So great conversation. Oh, Michael, go ahead. Michael, sorry.
Well, I just want to reinforce the point. I mean, in my own case, I define optimal health as a balance of physical, emotional, social, spiritual, and intellectual health. And I think all of us in the panel do, but you're right. You know, where's the money, what's paid for, and the other areas are neglected, no doubt about it, regardless of our individual philosophy.
So great conversation. Please join me in thanking Michael and Kathy and Nico. And now finally you get a formal break this morning for 15 minutes. So a little 5 minutes after 11 we'll reconvene. Thank you so much.